Hello my friends. I'm Dr. Gupta. Today I have come to talk about the techniques of treatment of erectile dysfunctions. I tell you a very common case. The common cases are for the people who are about around 45 years of age. And the common complaint is there is a sudden drop of sex performance. What are the common complaints? He gets an erection which is not as hard as earlier, and the second problem is that he cannot maintain it up to penetration, or even if he maintains it up to the penetration, after one or two strokes it goes soft. So a weakness of erection and inability to maintain erection is a very common problem for all men above 45 years. If you don't have this problem today, you may get it tomorrow. And I tell you, this is the first step of decline of sexuality. So we must take a precaution. What people do, people will look into the internet, they'll find out about 300-400 medicines, and they start trying one after the other. What happens with this self-treatment? He gets an erection, he can perform, and he feels happy. But after 2 months, 3 months, or maybe 6 months, the medicine stops working in him. And then he's again afraid and tries with another kind of a medical pill. So he takes another medicine, he gets some response, the response goes away, this time in the much shorter period. And third pill that he takes does not work at all. So that's the end of his chapter. But we doctors, we treat from the root cause. We know this is a combination of declining desire, this is a combination of declining hormones, this is a combination of declining blood circulation into the penis. These are the three very common causes of this problem. If he has got diseases like hypertension, diabetes, thyroid problem, liver problem, heart problem, whatever we take it, that they should be all under control. So all the parameters from this other ailments should be under control. That's step 1. Step 2 is to improve his blood circulation inside the penis. And for that we have to use medicines like vasodilators and physiotherapy, which includes vasodilatation. 2 types of physiotherapy we can use. One is IFT, another is the acoustic wave therapy or the shock wave therapy. With the combination of medicines, we are getting fantastic results in almost all our cases. And then the question comes whether the medicine has a side effect. No sir, absolutely not. There are absolutely no side effects to the medicine. Question number 2 that comes, how long I have to take the medicine? That depends on person to person. Some person takes it for 1 month, or 2 months, or 3 months, and they get fit. For next 5 years, they don't need anything. But in some cases, we have to give them a good relief, and then we have to keep a little maintenance dose. That's the 2 kinds of an outcome. But as you age, your mind is filled up with more responsibilities and more thoughts and more impressions and more knowledge. The desire for the sex, the space in the mind for the sex gets reduced. This you have to take care. This is your own job to maintain your sexual fantasy as long as possible. If you maintain your sexual fantasy, you will maintain your sex life. That's the treatment of today. That's it. Thank you so much.